Prostate cancer typically develops in men over 40. African American males are a much higher risk for getting prostate cancer, as are patients who have a strong family history of prostate cancer. It's estimated about 250,000 cases of prostate cancer will be diagnosed in the United States alone in the last year. Therefore, it's a very prevalent disease and something we're all very concerned about in the United States especially. Typically, patients are found to have prostate cancer after they undergo an annual screening for prostate cancer. We typically recommend that patients start the screening process at the age of 40, which involves a digital rectal examination and a PSA blood test, which will help identify patients at risk for cancer. It's rare for a patient to have signs and symptoms of prostate cancer, but symptoms that can happen would be blood in the semen, blood in the urine, pain or problems urinating. Those are some common symptoms that they may have. If a patient's rectal examination is abnormal or their PSA is elevated, then they would undergo a prostate biopsy, and we perform that in the office. The biopsy usually takes about 10 minutes. It's a transrectal ultrasound guided biopsy of the prostate, and we take about 12 biopsy cores under local anesthesia, and that'll help us to determine whether or not a patient has prostate cancer. It's important to take many factors, after a patient's diagnosed with prostate cancer, or to consider many factors. One factor would be consider the tumor grade and the stage, how high the PSA is, what age the patient is, and what other medical problems they may have. We take all those factors and we talk to the patient about all the possible discussions or available options for treatment. Some of those treatment options include active surveillance, which would just allow us to watch the PSA and also consider another biopsy down the road if we felt that was necessary. Another option would be external beam radiation, and typically that involves about 40 treatments where a patient would go 40 different times and radiation is delivered externally to the prostate. Another option would be brachytherapy, which is radiation that is delivered locally to the prostate. This is either done with permanent seeds or temporary seeds. And last but not least is surgery. A lot of patients are candidates for robotic or laparoscopic prostatectomy. Typically, patients under 75, patient with low to intermediate risk prostate cancer. With a robotic prostatectomy, the one large benefit is having a camera inside the body, and with this camera you have 10 times magnification, so you can see things much larger than they normally would appear. Therefore, you can see individual structures, individual blood vessels, nerves, and that sort of thing, and you can do a better job at trying to spare any injury to those structures. The other benefit is you don't have to make these large incisions. You can make these small keyhole incisions and put the surgical instruments through these incisions. And because of that, patients may have a little bit less pain after the surgery. And also, when you're sewing the bladder back together to the urethra, you can see that anastomosis so much better, which may translate into better outcomes for the patient too. After the surgery, we usually see the patients back about a week later, take their catheter out, talk to them about the pathology results, and then for the first year we typically, or I like to at least, check their PSA every 3 months, and then we typically back off over time. Usually, we like to follow these patients long term to make sure they have the best outcomes with their surgery, as well as make sure that the cancer does not come back. I think that St. Francis is definitely committed to providing the highest quality care to all patients, not just urological patients. They've also been very open to providing the most innovative care for these patients, which is a testament to the robotics program. I think the X factor with St. Francis is that it's just the support crew is wonderful. The nurses and the support staff are just excellent people, and they're always looking to make sure that your stay in the hospital is somewhat enjoyable. I mean, no one wants to come to the hospital, but the people here tend to go out of their way to make sure that everybody feels comfortable when they're in the hospital. So I think that's the most important thing that St. Francis does for our patients.